given the developments that we've talked about, is there any particular needs that you think our staff require in order to make sure they're fully equipped to embrace some of the technology that we've implemented?
That's interesting, because I think probably before this all started, I would have said we need to pull people out, we need to show them how to use kit, but actually it's the experiential learning element of it that I see work so well. So the walking alongside staff when a new piece of technology comes along, as opposed to saying, this is, computer X, this is what you can do with it. It's application that's the important bit. So I'm not sure you can necessarily hardwire or deliver in a cold manner, this is what this does for you. I think it has to be done in real time. And what I observe with staff in practice is they've so appreciated people like Anna and Dion and others actually going into the area and saying, now this is how you use it. And it'd be like, oh yeah, no, that's really easy. I don't have to worry about it. Whereas I think some people might have an anxiety going to a classroom to try and use a new piece of kit that they won't know how to apply it. It's like any education, really. It has to go with the application. So I think the more time we can invest with, this is what this can do, this is how you use it in practice, has to be the way forward, as opposed to trying to do it remotely. I think the other bits around that, though, as we develop these systems, is not throwing the baby out with the bathwater in terms of documentation, because it'd be quite easy, and I've seen this even with paper-based systems, that care planning becomes very much a tick box exercise. What we've got to do, whatever system we build in, is still build back in the element of thinking about what your patient needs, because it's easy to go through a tick list and say, yes, I've done that assessment, but actually what does that mean for the patient at the end of the day? What intervention are you going to put in place? How are you going to document and evidence that? We absolutely can't get away from, because that's right for the patient, it's right for consistency, but it's also right for the practitioner.
If you think forward, what are your aspirations for nursing practice in the future?
So my aspiration for nursing practice is that using the information that's available to them through all the systems that we're developing, being able to very clearly articulate what nursing represents. When you look at our medical workforce and our medical colleagues, they use research, they use data to say, this is what we do, this is how we know we do it. Nursing's always been one of those professions where people get on and do these things, but actually sometimes lack the weight of the evidence behind them that says, this is how I know. So I think we've now got, with the digital platforms, the opportunity to aspire to say, I know I'm this good because, and I think that's very clearly how we need to kind of raise the profile of nursing. But alongside that, I think these systems that are in place should release time to care.